Yeah.
So
fine.
thanks for having me here today, and I'm very happy to present something on the H2O project, which is also a very large project, similar to the to what we just heard about IDERA. And H2O actually started 4 years ago, so we have 1 more year to go in our project. And like IDERA, what we have heard before does also apply to H2O. So we are planning a sustainability phase after the project funding is over. So the idea would be, and the mission of H2O from the beginning was to make this sustainable in the future. And I would like to tell you a little bit what our concept and our mission is, and what the problem actually is, why we need the H2O initiative, and also how H2O will shape the EHDS in Austria. And I was very, it was really nice to hear a lot of good words about Austria, because normally in Austria, people are not so much satisfied actually with the data and also the availability of the data here. Of course, we have the ELGA infrastructure, and I'm sure you have heard of that already in the other seminars this week, which is basically, or should be, something like an electronic health records, but it's not there yet. Yeah, but it's more of a platform where medical documents can be shared, and it's also the data cannot be used right now for research. Yeah, but still we have this infrastructure, and we I think in many areas there has been lots of advancements, yeah, but in many areas we think that in Austria a lot more could be done to facilitate data access and data sharing. Yeah, so let's go into H2O a bit. So H2O means Health Outcomes Observatory, and we have come up, and I told Rada before, in the beginning, when we started with the project proposal, we came up as public consortium with the acronym H2O. And interestingly, and that was very nice, the industry consortium also came up with the same acronym. And when we were selected, there was no doubt that we would use this acronym H2O. And H2O has been also an analogy for us in a way in the project, because we see data like water. So the idea would be that data would be or would really be an essential resource for researchers, for primary use, of course, for the clinics, to make the conversation between patients and between patients and healthcare professionals much easier. And for this all, we see data like water, something like an essential resource that should be treated in a way or managed in a society like drinkable water. Yeah, so and also I think it has the implication of a flow. So we also want to make data flowing from the patient in a way, from the clinical health records to the researchers, to the data analysts. Yeah? So for all that, I think water serves perfectly as an analogy. So why do we actually need something like H2O? What is the problem? And the problem is really the sustainability of healthcare. Yeah? And we have heard that before. So what will be the major problems in the future? And one of the biggest problems will be really that it will be too expensive. So there will be new technologies, there will be a lot more precise, better, even more treatments that will make people survive longer, and that all will make healthcare more expensive. So we need to see how we can make this sustainable while it's still accessible for everyone. Yeah? And I think this is also very important in our liberal democracies that we still have in Europe, that healthcare should be accessible to all the individuals in society, basically. Yeah? So the financial pressure is one of the most prominent problems that we will have in the future, and this will come together with staff shortages in the area of nursing, but also in all the medical areas, and in the European University Hospital Alliance, where we discuss a lot how we can achieve better outcomes for patients. And the European University Hospital Alliance is a little bit like a collaboration, and not really an association, but a collaboration between the biggest university hospitals in Europe. And there we discuss a lot how we can overcome these staff shortages right now. Yeah? So this will be a very prominent issue also, together with the financial pressure in the future. We have the digital transformation, and I mean, you all know that you have this kind of backgrounds, you come from this background, so we will be facing this digital transformation even more in the future. And Phil and Christian already said we will have many more, we will have much larger volumes of data. We will have more data about patients, data from different sources, from different soup and source systems. Yeah, so lots of these changes are still ongoing in the digital transformation. Yeah, we have challenges in drug development. Of course, this comes very much from the private sector industry. Yeah, and also access to drugs, to algorithms, to medical products will be an issue in the future. And maybe not only access, but maybe fast access also, where drugs are produced, where digital devices or where technology is manufactured, and how this can be available for the people in Europe, for example, or also in other countries around the world. Yeah, and I think, and that's really important, I think, and that's also where the H2O model is very much built on. In the future, I think we will even see more the need for patient-centered care. Yeah? Right now, I think we talk a lot about technology, about digitalization. We have seen a lot of very nice technologies of products, of new drugs, yeah, for the patients, new biotechnologies. But what I think is very specific to medicine is the need for human care about humans in a way. Yeah? So we will even in the future see more patient centricity, and patients are better informed now. They have a lot of good information also from a lot of platforms where they can access medical content. But what we still need is this the human to human interaction, the patient centric care. So all our efforts need to be centered around better outcomes for patients. And traditional metrics like clinical data, for example, do not sufficiently capture how patients are doing, how patients are feel. And for this, we need patient-reported outcomes. And patient-reported outcomes are currently not collected on a scaled level. Yeah? So in some areas, they are collected, but not all over in healthcare, and they are not collected in a consistent manner. Yeah? So very often even in the same country, even in the same hospital, sometimes different systems, different questionnaires are used. Yeah? And H2O really set out to harmonize this fragmented outcomes data landscape in Europe, and also in our first countries where we will implement this model. And I will show you on the next few slides where this actually will take place. But very important is really to have this patient-centric data there collected consistently together with the clinical data, and to make this really a harmonized outcome measurement scheme. So this is very often called value-based care, yeah, where we look into the value that we create with medical interventions for patients. So what is the H2O model? And I already said, first of all, in order to measure outcomes consistently, we need to agree on what we actually want to measure. And we have done that in the first phase of our projects together with experts, but most importantly, also together with patients. Yeah? So we have not newly developed core outcome sets, but we have agreed on core outcome sets, and we have made the core outcome sets more pragmatic. Yeah? So more a bit shorter. Yeah? So to have it easier for the patients, and patients will not fill in if you send I don't know, 30, 40, 50 questions to the patients every other week. They will not do this. Yeah? So we have really cut this down on pragmatic sets. We will implement this outcomes data collection in 3 disease areas, or actually 4 diseases in total: in diabetes, in IBD, in inflammatory bowel disease, and in breast and lung cancer. And we will do this in Austria, in Germany, in the Netherlands, and in Spain. Yeah? And we have what you can see on the right side here, we have a few more countries that would also set up such a national health outcome observatory in the future. Right now, we have set up those 4 national observatories together with a pan-European observatory, which is located in Denmark, and the Danish Medicines Agency is involved in this, and the authorities in Denmark. And the role of this pan-European observatory will be to oversee the outcomes data collection, to harmonize this, and to be like a platform for exchange and discussion about outcome measurement also in the future. So right now we are in the phase of data collection. We have recruited more than 1,400 patients right now who are already participating in H2O and are using the technologies, the apps that we are providing to them for filling in the questionnaires. So one of our ambitions really is to empower patients, so that they can measure their outcomes in a standardized way through digital technologies. And this should, and this is according to what is defined also in the EHDS. We have a primary use of the data collection and later on a secondary use for research. But I think what is really important, if you have a very strong primary use, only then you will be able to gain a sufficient quality of the data. So if it's not meaningful for the patients, they will not fill this in properly. And if it's not meaningful for the clinicians, if the clinicians will not use the PROs, no one will fill that in, and the quality will be very bad of the data. So the idea is to really make a very strong primary use, to give patients really something into the hand, how they can communicate better with their clinicians. So that's what we say is like a common language. So when we measure these patient-reported entities that you can see here on the right side, we want to standardize this in a way that patients and clinicians are talking from the same things, and that clinicians, for example, immediately see how patients have been doing over the past weeks when they come for the clinical consultations. And the methodology, I've already said that a little bit earlier on. So we have done extensive expert studies, extensive patient studies. We had patients participating in all our tasks and have set up a very rigorous Delphi process to really ensure that we measure something that is meaningful for the clinicians, but also for the patients. And we collaborate with organizations like ICHOM, international consortia that develop core outcome sets and specifically focus also on what matters to patients. We have done this in the first phase of the project and are implementing now this H2O blueprint in the 4 countries that I showed you before. And the idea is to really improve the communication, to have a very strong primary use case of the data, and then also to make this data available to researchers who have a legitimate interest in accessing the data. And this will go via this national and the pan-European observatory, and H2O has built up a multi-stakeholder governance model. So it will be different stakeholders deciding on the research questions and on the projects for which the data should be used. And we are right now in the process of discussing whether trusted research environments could be built up nationally or also on a pan-European level, and very much currently discussing also our sustainability strategy and the business model for after our funding period, when the EU funding will come to an end. We see H2O as a contributor to the European health data space, and you can see lots of other projects here, including, of course, the IDERA project that you have just heard. And there is, of course, more projects, and Phil has mentioned that, I think, before. Lots of big projects are ongoing, and all of them, I think, have some connection to facilitate the European health data space, and H2O specifically wants to support regarding the standardization of the data collection, regarding the connection to the digital devices and the technologies, but also wants to contribute the importance of patient-reported outcomes and patient-reported data in the future. So what we still see and we still have, and I think, Christian, you have mentioned very nicely that in Austria, the things are very, how to say, very advanced. Yeah, this is a slide that I very often show also at national conferences, and I think we still do not have enough standardization of the measurements. We still have fragmented data. It's not effectively accessible and often not usable for the validation of algorithms, especially from the private sector industry. It's not accessible, and there's very little trust in science. Yeah, that's also something what we see, I think, all over the German-speaking area. Yeah. What do we need? So what should change? Like we said, I think secondary use with sufficient quality of the data comes with a convincing primary use, and only if you have a very strong primary use. Visualizations and dashboards. So we really need to make sure that the clinicians and the patients see the benefit in the data collection. Otherwise, I think they will not do this. So they really have to have a benefit of this. Yeah, and for this, I think we need to visualize. We need to give them nice tools. Yeah, so that the patients can see how they have been doing in the last weeks, that the clinicians can immediately see where the difficult areas of the patients were in daily life. Yeah, then I think this all gets value. Sometimes we think it's more important to convince the clinicians regarding data sharing than the patients. And we just today had a consortium meeting of an Austrian national project on data donation, which is coordinated by the Austrian Institute of Technology. And there it was also, will be very important to convince the patients and the clinicians regarding health data donations. Yeah? And we sometimes think that, especially, and we see in all the surveys and the interview studies that we do, that patients, specifically when they have a disease, they are very likely to agree to sharing their data, but it's not so likely if people are healthy, yeah, of course, and do not have chronic diseases, for example. Yeah? And sometimes also the clinicians are very skeptical. So I think we really need to convince them and show them good use cases, how they can benefit from all this. Yeah? We will have linked microdata, hopefully, in secure processing environments so that people can really analyze the data. We already have established a very strong multi-stakeholder governance model, and that also applies to all these national H2O observatories as well as to the pan-European one. And we need an international focus, I think, also, and we have to make sure that also in our liberal democracies in Europe, yeah, we have the possibility to collect these larger data sets, and we will not have to buy data in other countries, maybe where you can really buy large data sets, but where you have very different political systems also where this data are collected. So I think it's really important that we build these data infrastructures together in Europe, and we make use really of the potential that the European health data space and projects like IDERA and H2O offer to us. And I also think it's critical that we get this data fast, yeah, for the analysis and for research. So it's no use if the data is old and if there's no access, really, no quick access to the data, no fast access to the data. Yeah. And this was my last slide, and I hope Christian said in the beginning that he has never listened to an H2O talk. So I hope I have satisfied you, Christian, and you have learned a little bit about what the H2O project is about. Yeah. So thank you very much for your